Good morning. This is Varghese Thomas from Germany International Academy, Calicut. We have Shanton is with me, and good morning, Shanton.
Good morning.
So, are you ready for your speaking examination?
Yes, sir.
Right? Okay. So before moving into the session, may I know your complete name, please?
Okay, my name is Shandon Maitramita.
Okay. So I may call you Shanton, right?
Yes.
Okay. So Shanton, can I have your identification document for verification?
Yes.
Okay. All right. All right. So, can we have a little chat before we start with the role play card?
Yes.
Okay. So you said your name is Shanton.
Yes.
May I know your profession?
I'm nurse by profession.
Okay. So what's the reason behind that you are choose this profession in your career?
Okay, thank you for a wonderful question. Because from my childhood onwards, it's my dream to serve people. I believe nursing is a noble profession, help me to serve the people, and also it's a service-oriented one.
Okay. So, Shanton, you said that you're a nurse.
Yes.
It's very nice to hear that. And which country you would like to move, and may I know what's the reason behind that?
I would like to migrate to the United Kingdom.
Okay.
Because many of my friends are working there. From them, I came to know that there are a lot of scope for nurses over there, and the healthcare sector it's well developed and having lots of opportunities for professional growth.
Okay. Have you encountered any difficult situation while you are taking care of a patient?
Yes, of course. As you know, the nurses has a great role in dealing with the patients. As an emergency nurse, from my initial days, I had encountered such a situation. While I was on ambulance call, I had a patient who was very sick and he suddenly got cardiac arrest. So I'm alone and I'm not able to do all activities at a sudden. But instructions from my seniors, as far as the God's grace, I am able to resuscitate him properly. So I believe that the God's hand also involved in that.
Okay, thank you. Now, I have a cue card for you.
Okay.
And from which you have to prepare for 3 minutes. Following that, you will have 5 minutes time for the presentation. In between, if I ask you to stop your conversation, that will be the end of your session. No need to worry.
Okay.
Are you ready?
Ready.
Okay. You will have a piece of paper. If you need to prepare some notes, you can do that. And this is your cue card. This is the paper which you can prepare the notes. And if you need to use this notes and the cue card while during your presentation, you can do that.
Okay.
All right. So are you ready?
Ready.
Okay. So your time starts now. All right. So your time for preparation. So are you ready for the presentation?
Yes.
All right. No worries. Be relaxed,
Okay.
and you can start your conversation.
Good morning.
Good morning.
My name is Shandon. I'm the head nurse in this department.
Oh, all right.
Okay, before we heading further, I would like to check your name.
Sure. My name is Peter.
Okay, Peter, how are you feeling now?
Well, as you know that I has undergone a thyroid surgery last day.
Yes.
As my doctor anticipated that I will not have any pain after the surgery. But you know, I'm totally concerned as I have severe pain while speaking and swallowing. So this makes me a lot of discomfort. I don't know what I have to do for this.
Okay, Mr. Peter, anyway, I'm sorry to hear that. Don't worry because these kinds of difficulties are common after the thyroid surgery.
Okay.
Okay, we will have some measures to reduce the pain.
Oh, that sounds good. So can you please explain all those?
Okay, before that, I would like to check your pain. So can you please rate me pain in a scale of 1 to 10?
Yeah, I do say that it's about 8 or sometimes 9.
Oh, Peter, so you are having severe pain?
Yes, exactly.
Okay. Do you have any idea what's the reason for this kind of pain?
I'm not very sure about what is this exactly, but I think this is because of surgery.
Okay, Peter, that's correct one. Because this surgery will cause some changes on your vocal cord.
Okay.
As well as the presence of some incision at your neck.
Okay.
Okay, those two are the causes for this kind of pain.
Okay.
Okay, we will have some pain medication and we will have some modification and some instructions.
Oh, all right.
Okay, so first and foremost, I would like to recommend you that you just need to reduce talking.
Oh, okay. But are you sure that if I do that, my problem will be resolved?
Yes, Mr. Peter. So if you follow all our instructions, it will help you to heal faster and reduce your discomforts.
Okay, fine. I'll do that.
So first thing, as I said, you just need to give some rest to your vocal cord. That
Okay.
will reduce the pressure in your vocal cord. So
All right.
it will cause us much faster healing.
Okay, fine.
Okay. Next thing, just you need to focus on taking food and doing some exercises.
All right.
Okay.
So, what kind of food I can have on these days?
Okay, Peter, that's a good question. So I recommend fluid diet. Okay.
Okay.
It consists of all juices, liquids, and what all kinds of food that you would prefer.
Okay.
Okay.
Fine.
So that it won't interfere swallowing ability.
All right.
Okay, and it also reduces stress while swallowing.
Okay. And Sinus, I'm also a bit worried about because I'm feeling kind of breathing difficulties while I'm trying to sleep. So this makes me a lot of worries and concern, and I'm scared to sleep. So what should I have to do for this?
Okay, Peter, don't need to be worried about that. We will have some modifications while you are while you are sleeping.
Okay.
So we'll provide you with some pillows so that you can lie elevated.
All right.
Okay.
So you're saying that my head end will be elevated, right?
Yes. While elevating
Okay.
the head, then you can easily breathe.
Okay. Fine.
And you just also need to reduce your anxiety. So anxiety itself causes some problems.
All right.
And in addition, I also recommend the breathing exercises.
Okay, but how can I do that? Because I don't have any idea about it.
Okay, so we will provide you with some leaflets and we will demonstrate it for you.
Oh, that's good.
Okay, so after that, if you're not able to follow this, we will arrange a consultation with a physiotherapist.
All right.
So that would be better for you.
Okay, that's nice to hear it from you, that.
Okay. So, Mr. Peter, would you like to have any clarification on what I have said?
I think it's all pretty clear and I don't have any other concerns.
Okay, anyway, if you have any other concerns or difficulties, please try to contact us.
Sure.
Okay, anyways, wish a speedful recovery.
All right. That's nice talking with you, and I have clarified all my doubts regarding my problem. And see, Mr. Shantam, that's the end of your session, and that's the end of your speaking test. Thank you.
Thank you, sir.